Hi. Welcome to Homeopathy Medicines. Today in this classic Homeopathic Materia Medica lecture discuss about homeopathic medicine Ferrum metallicum by Dr. Farrington, MD. Before starting this video, please subscribe to this channel. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Ferrum metallicum, its uses and symptoms. Ferrum has two complements, cinchona or china, and alumina. Ferrum and alumina are complementary in chlorosis, and ferrum and cinchona in anemia from loss of animal fluids. Now the best antidote I know of to iron is pulsatilla. And, as good fortune will have it, pulsatilla also antidotes cinchona, which is so frequently given in combination with iron by old school physicians. Ferrum acts best in young persons, male or female, who are subject to irregular distributions of blood. The cheeks are flushed a bright red, giving them an appearance of blooming health, and yet this is only a masked plethora. When they are unexcited and quiet they are apparent to be pale and the face has an earthy color. Among the evidences of this irregular distribution of blood we have the following symptoms: violent hammering headache, which is usually periodical in its return and worse after 12 o'clock at night, nosebleed, with bright red flushing of the cheeks, the nose is filled with dark, clotted blood during an attack of catarrh, asthma, associated with an orgasm of blood to the chest, and which is worse after 12 p.m., at which time the patient must sit up and uncover the chest. He uncovers the chest to get cool, and sits up in order to breathe. Ferrum is also suited to hemoptysis, especially in young boys or girls who are subject to consumption and who are just in the incipient stages of phthisis florida. Almost all these symptoms are excited by any emotion and are accompanied by great fatigue, despite the appearance of health. Even the neuralgia which ferrum may cure has fullness of the blood vessels as a concomitant condition. This neuralgia is excited by washing in cold water, especially after being overheated. The pains are of a throbbing character, and are worse at night. Almost all of these symptoms, both the congestions and the pains, are relieved by slowly walking about. Now you may understand the action of ferrum if you remember this one quality of the drug. It has the power of dilating the blood vessels, probably by diminishing the action of the vasomotor nerves, hence you do not find a full bounding pulse, as under aconite, but a full, yielding pulse. You will find, when ferrum is indicated, that the walls of the abdomen are sore, as if bruised. This is due not to inflammation, but to dilatation of the blood vessels. This places ferrum alongside of gelsemium and separates it from aconite. We have next to study ferrum as a chlorotic remedy. We do not use ferrum, or at least we should not, as allopathic physicians do in chlorosis, because in this disease there is a defective amount of iron in the blood. That is not the homeopathic principle for giving the drug. The homeopathic principle is to correct the defective supply of hasmatin which lies back of the want of iron in the blood. This deficiency is due not to want of iron in the food taken but to want of power on the part of the system to assimilate it. Therefore ferrum is not the remedy in chlorosis. It may, however, be indicated in that disease when the following symptoms are present. In the first place, in a general way, it is called for in erytistic chlorosis, that is, chlorosis with erytism of blood. It is usually aggravated during the cold weather, less so, however, than it is during warm weather. The face is ordinarily of a pale, waxen or earthy hue and subject, at every little emotion, to flush up red. The slightest emotion of pleasure or distress, the sudden entrance of anyone into the room, the meeting of a stranger and, in fact, anything that is calculated to disturb the mind, causes flushing up of the face. The cheeks become bright red. Now this is not a true plethora, it is a masked case. The face is really of an earthy hue, but flushes up on any little emotion. The stomach is always out of order, the patient being subject to gastralgia and heavy pressure in the region of the stomach. With this there is a feeling as if something rolled into the throat and closed it like a valve. There is great aversion to meat, and, in fact, to anything that is really nourishing. Food has little or no taste. The patient has frequent spells of nausea, which come as soon as he eats, or periodically at 12 p.m. Here it reminds one of arsenicum. Mucous membranes are abnormally pale. For instance, the vermilion of the lips is exchanged for a simple pale pink. In the case of a male patient, the glans penis is shriveled and white, almost as pale as the prepuce. So, too, the cavity of the mouth and the gums are almost white, showing this bloodlessness. The menses are profuse and consist of watery and lumpy blood, and are attended with labor-like pain in the abdomen. The patient is very inactive. It is with great effort that she can stir herself out. She is relieved by exercise. She is chilly during most of the day, with bright red flushing of the cheeks in the evening. There is palpitation of the heart, with well-marked bellows murmur. The blood vessels all over the body throb violently. Sometimes the anemia progresses so far that the patient becomes affected with edema of the feet. The Ferum patient is subject to frequent congestive headaches, with pulsating pain in the head, worse usually after midnight. The face is fiery red during the attack, and the feet are cold. It is here very much like belladonna, but is indicated in a very different class of cases from those calling for that remedy. Such patients always complain of vertigo or dizziness, which is worse when they rise suddenly from a lying to a sitting posture. Walking over a bridge or by some running water or riding in a car or carriage also causes this vertigo. These are the cases in which you will find Ferum to succeed. An English physician has advised that Ferum be administered after a meal instead of before. He thinks it acts better then. I do not know whether this is so or not. Another use that we may make of Ferum, arising from its tendency to produce ebullitions of blood, is Hemoptysis florida. It is indicated in young people who are subject to tuberculosis, here rivaling the well-known phosphorus. It is indicated more than phosphorus when there is this apparent plethora, with great oppression of the chest from any little exertion. The nostrils dilate and work hard with the efforts to breathe. There is frequent epistaxis or nosebleed, and also hemoptysis, the blood being bright red and coagulated. The cough is of a dry, teasing character, and is made worse after drinking anything warm. It is usually associated with bruised, sore feeling in the chest, and with dull, aching pain in the occiput. In addition to this erytistic we may have Ferum indicated later in the case when expectoration is purulent and greenish and has a very bad odor, and is mixed with blood streaks. This reminds me of a salt of Ferum, Ferrum phosphoricum. This is a remedy which was suggested by Sisler in all cases of inflammation before exudation has taken place. He bases his prescription on the combined effects of Ferum and phosphorus. Ferum phos stands midway between aconite and gelsemium. In fact, it develops that stage of inflammation which the pathologists describe as indicated by enlargement of the blood vessels, with paresis of the vasomotor nerves. Schussler proposed Ferum phos as a substitute for aconite. It has been given so many times that I now offer it to you with these qualifications. The indications for Ferum phos are these: the pulse is full, round and soft, the inflammation has not yet gone on to exudation, the discharge, if it is a mucous surface that is affected, is blood-streaked. In other words, the condition calling for it is surcharging of the blood vessels. If a patient with phthisis should take cold, and so become greatly prostrated, and have this blood-streaked expectoration, Ferum phos, even in the 200th potency, will quickly quiet the pulmonary congestion. So, too, in the secondary congestion following pneumonia. The right lung, for instance, is inflamed, when suddenly the left becomes congested. Here Ferum phos again acts. Or, again, on a warm summer's day, a child is exposed while perspiring, and the perspiration is checked. In consequence of this, inflammation of the bowels sets in. The stools are watery and bloody. Here, again, is a case for Ferum phos. In the beginning of dysentery, Ferum phos never does any good if there is tenesmus. then you will have to give mercurius or some other remedy. We may use Ferrum metallicum itself in diarrhea. The stools contain undigested food, and come so soon as the patient attempts to eat. In summer complaint of children or cholera infantum, we find these symptoms recurring quite regularly or periodically just after midnight, when lethargic stools may be accompanied by periodical vomiting. These symptoms of Ferum place it with cinchona and arsenic in a little group of diarrhea remedies and rather in advance of oleander, this last named drug being indicated when the lethargic stools occur hours after eating. For instance, the child passes one day that which he had eaten the day before. With cinchona and arsenic, the stool appears more after than during eating. Argentum nitricum may also be thought of in these cases of diarrhea. It seems as if the child had but one bowel, and that extended from mouth to anus. In uterine hemorrhages, Ferum is useful when there is a flow of bright red blood, often mixed with coagula, and this is associated with a great deal of flushing. The face, which is ordinarily earthy and sallow, becomes bright red and flushed, breathing becomes rapid and a little labored, just as it is in ipecac. The pulse itself is very much increased in frequency and in strength. Ferum in hemorrhages seems to stand between cinchona and ipecac. Like cinchona, it is suited to very much prostrated cases in persons naturally anemic. It is allied to ipecac, in the bright red gushing flow of blood and the difficulty of breathing. Ipecac suits hemorrhage that comes with a gush. It may be associated with nausea and it may not, but there is very apartment to be loud, hurried breathing. Lastly, Ferum is indicated in intermitting types of fever, particularly after the abuse of quinine. You find during the heat, distension of the blood vessels, particularly about the temples and face, throbbing headache, enlargement of the spleen, and even dropsy. Thanks for watching this video. If you want more videos like this, please subscribe to this channel and press the bell icon. Comment us your feedback. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.